Good afternoon, everyone. My name is Shaun Tatipata. I'm coming to you live from Larrakia country. I'd like to start by acknowledging the Larrakia people as the traditional custodians of the land that I have the absolute privilege and pleasure to work, rest and play in. I'd like to extend my acknowledgements to Larrakia peoples, their elders, both past and present, and also their young and deadly emerging leaders that are paving the way forward and taking us towards the nation that we all aspire it to be. I am Woodity, I am Nuddenjerry. I was born and raised on Larrakia country. And today I'm talking to you with Karl Briscoe. He's the CEO of NATSIWIP, the National Association of Aboriginal and Torres Strait Islander Health Workers and Practitioners. Karl, brother, how you going? Thanks for joining me today. Before we start, tell us who your mob are, where you're joining us from.
Yep, not a problem. So, Karl Briscoe, I'm a Googie Allenji man from Mossman Daintree area in far north Queensland. I'm currently on Ngunnawal country in Canberra, the capital of Australia, as the CEO of the National Association of Aboriginal and Torres Strait Islander Health Workers and Health Practitioners. And I too would also like to just acknowledge the traditional owners on whose land that I'm undertaking this video conference today and pay my respects to elders past, present, and to our future elders. I would also like to acknowledge the many rivers, lakes, and mountains that make up these ancestral lands and acknowledge that these lands have always was and always will be under their continual custodianship. Thanks, Shaun. Great to be here.
Oh, deadly. Hey, how good was that acknowledgement? Well done, brother. It's always interesting, you know, we see a lot of acknowledgements made, but there's a lot of passion and pride that comes through when we are acknowledging our mob and the mob of whose country that we're on. So give me goosebumps just thinking about that. Too good. Now, we both worked as Aboriginal health workers. We both know how important the roles are in terms of providing culturally safe, high quality healthcare to Aboriginal and Torres Strait Islander peoples. We're recording this video today for a global audience though, and so many people viewing may not necessarily be familiar with what Aboriginal health workers or Aboriginal health practitioners are. Yeah. So could I ask you just to start by telling us a little bit about what Aboriginal health workers and Aboriginal health practitioners do, and in the context of an Aboriginal community controlled health service?
Yeah. I suppose just starting out, Shaun, you know, Aboriginal and Torres Strait Islander health workers and health practitioners, they are the only ethnic-based health profession in the world that has national training, curriculum, and national legislation and regulation that supports this profession. In terms of their work that they undertake in an Aboriginal community controlled health organisation, they very much are the first point of clinical contact in many of these organisations. So not only are they trained in comprehensive primary health care, you know, they also look at the preventative side as well as health education, health promotion, and also they look at addressing the social and cultural determinants of health. They very much are a systems navigator through the health service, but also a cultural broker between the community and the health service as well. I suppose this is why, you know, I have witnessed, you know, better health outcomes for our people are being achieved through Aboriginal community controlled health organisations with a particular focus on this workforce. There are two professions. So we talked about the Aboriginal and Torres Strait Islander health worker. Then we have the Aboriginal and Torres Strait Islander health practitioner. I suppose a major point of difference is that the Aboriginal health practitioner, they actually supply and administer medications which they undertake specific training for. They also are registered nationally with our national peak body, the Australian Health Practitioner Regulation Agency, AHPRA, and we have the Aboriginal and Torres Strait Islander Health Practice Board, which actually assesses applications for registration for the Aboriginal and Torres Strait Islander health practitioner.
That's great. Big role, not only within community, but also in advancing the health outcomes of Aboriginal and Torres Strait Islander people. You've been an Aboriginal health worker now for a number of years, an Aboriginal health practitioner. What attracted you to the role, though?
It's actually, I was actually asked to come down and have a bit of a conversation, and the next thing you knew, I was offered a job as an Aboriginal health worker. And I suppose, you know, what really cemented my mind, you know, to keep in the profession was that I went home one day and had a yarn with my mother, and I said to my mum, I got this job as an Aboriginal health worker. She said, oh, I was one of those, and told me her story about being the first Aboriginal health worker in Queensland. And so that was actually quite amazing in the Aboriginal health program that rolled out in the early 70s. That was prior to community control coming into Queensland.
Oh, that's brilliant. And where was that? That was in Mossman?
So that was in Mossman, yeah, the Mossman Gorge and the Daintree area. So where my people are from. Yeah. So it was such an honour to be able to work for my people. I really enjoyed, you know, the connection, the engagement, and, you know, in terms of providing culturally safe care, when our people are accessing services, you know, being the navigator, being the advocate for our people, when they enter into the hospital or the primary healthcare centre, to ensure that they're getting the best possible care that they can get compared to any other Australian. Yeah,
that's brilliant. And like you said, a real honour. You're still working for your people now. You're the CEO of the National Association of Aboriginal and Torres Strait Islander Health Workers and Practitioners.
Yeah.
Tell us a little bit about what NATSIWIP does.
Yeah, so NATSIWIP, we're a professional association that supports Aboriginal and Torres Strait Islander health workers and health practitioners in accessing professional development. The Aboriginal and Torres Strait Islander health practitioner, they're required to undertake continual professional development or CPD hours every year. So we make sure that we have resources to support them in fulfilling their obligations with APRA, their registration body. But also we hold professional development forums throughout the country to ensure that our workforce are getting access to professional development. We've also ensured that there's a national award that covers the Aboriginal and Torres Strait Islander health workers and practitioners. So recognising the different qualifications within that award that we're actually missing. And as of last week, we've just had a decision come down that recognises the qualifications, but also recognises allowances that other professions may get. And we thought, well, why can't our profession get them? So a damaged clothes allowance, for example, heat allowance, a couple of other allowances. But we just thought, well, if other professions can get these entitlements, why can't our profession? Yeah.
That comes back to valuing the role. And we heard you talk about the importance of this profession, these positions in community and within our Aboriginal community control health organisations. And being treated as an equal clinician, as an equal contributor to improving health outcomes has been a big part of what NATSIWIP has been doing over the last couple of years. So, yeah.
That's exactly right. You know, the recognition of this profession in the wider health professions of nursing, midwives, allied health and medicine, increasing our reputation and also recognition of the profession. We do think that has actually gone some way in being increased in 2012 when the practitioner was registered nationally with AHPRA. That has increased the recognition, but also the respect that it gets from other health professions too. So we were seeing, a lot of the times they were being disrespected in their roles because it wasn't actually understood what they do. And Nazi Whip has also worked hard to ensure that understanding across the broader health system to ensure that our roles are respected and given the professional, stance that they should be given just as other health professionals.
Nice, deadly. Hey, but well done. It's largely been due to the great work that you've been doing as the CEO and your amazing team, and of course your board, made up by Aboriginal and Torres Strait Islander health practitioners and health workers. In terms of numbers, how many members would Nazi Whip have?
So we have just hit the 1,000 member mark as of today. I counted it this morning before I jumped on to this recording, and we've hit 1,000 members. So they're Aboriginal and Torres Strait Islander health workers and health practitioners. We have about 2,500 members in total, but of our profession that we support for better health outcomes for our people, we have about 1,000. Yeah.
Yeah. Wow. 1,000. That is a significant milestone. And in terms of the importance of that workforce, we know that there's more work for us to do in communities and in closing the gap.
Yeah.
You've done a lot of work around workforce planning and trying to identify what scale up we need of these professions. So over the next 10 years, how do you see the profession growing in terms of numbers?
Yeah. So we've been involved in the development of a national Aboriginal and Torres Strait Islander workforce plan. And we recognise that we call it harmonisation, of drugs and poisons legislation across the different states and territories is so different. So one of the initiatives that we've pushed for in that workforce plan is national harmonisation. So no matter which state or territory you work in, you can supply and administer medications and work to your scope of practice that you've also been trained in. I suppose the other national scope of practice that we've pushed for was a national minimum set of basic observations that no matter which state or territory you work in, these will be the national minimum standards you're allowed to work to. So that's some of the, I suppose, big picture or big national initiatives, what we've been involved in. But we've also been approached to provide advice and information on specific career structures, awards in each state and territory. So we provide that professional support as well in order to recognise, our professions within the different states and territory awards and career structures systems that they have.
Oh, well done. That is deadly. We're getting greater recognition. We're growing our numbers. We're growing our workforce. We're growing our scope of practice and cementing ourselves within the health workforce and the importance of these roles in the health workforce.
Yeah.
So we're already deadly. We're getting deadlier. Well done. We've touched on this briefly, but I'm wondering if you can chat to us about what culturally safe care looks like, what it means, and how Aboriginal health workers support that to occur, and more importantly, support the health system to be more culturally responsive.
Yeah. Okay, so in terms of ensuring culturally safe care is provided to our Aboriginal and Torres Strait Islander people when they access, say, eye health care, their eye health clinics and care. Our Aboriginal and Torres Strait Islander health workers and health practitioners, we understand that they have a cultural intellect that cannot be replicated. It's not the same as mainstream health services. So they know their communities and are often, the support and advocate for our people when they're accessing health services. I suppose what is great, to see that we actually, it was launched in February 2020. Our lead registration or regulation agency, AHPRA, they adopted a definition of cultural safety, which is cultural safety is determined by Aboriginal and Torres Strait Islander individuals, families, and communities, as well as a health professional undertaking a critical self-reflection on their own biases, on their own values and beliefs, and also, the power differentials that are there between the client and the actual health professional. We are seeing racism, also being addressed in a number of our organisations, especially the Reconciliation Australia's barometer, which is recently, that report is released every 2 years. It highlighted it still exists, as well as health services accreditation, also looking to have an accreditation standard around how culturally safe their services are. So it's looking to ensure that these services are culturally safe for our people when they're accessing them.
And that flips it, doesn't it? Flips it from focusing on the clinician
Mm-hmm.
and their practice, but also to take the perspective of the client, of the patient, that's the community members that is accessing services. It's all about how they feel. So it's the perception. So it's about feeling safe when you present. And there's now frameworks in place to be able to measure that and to support health services to respond to that better. Yeah.
That's exactly right. And, what is cultural safety? Well, the definition that AHPRA has, it's determined by not AHPRA, it's determined by individuals, families, and communities. So in order to provide a culturally safe health service, you need to ensure that you've engaged, you've co-designed the service in order for it to be culturally safe, so our people can access services, health services.
That comes back to the importance of Aboriginal community control health services, Aboriginal community control health organisations, because that's their very model, isn't it? Engage, co-design, construct, and deliver.
Yeah, that's exactly right. And I suppose, the Aboriginal community control health services, the makeup of their board is from local community members. So they understand, they live and they experience the day-to-day health issues and challenges, and they ensure that they set the direction for that service to deliver on specific health conditions or health issues that they have experienced as clients or, as community members as themselves. So you're made accountable to the local people, that you work under within that particular health service in terms of the governance arrangements.
What we see from that also is better health outcomes. Yeah, you would know all about the evidence pointing to that. Yeah,
that's exactly right. And so our people providing, culturally safe care, of course you will get better health outcomes. We have experienced ARCHOs, and there's evidence and research that supports better health outcomes with that model of care, more so when you've got someone, say, down in a capital city making decisions about what should be delivered in a regional or a local centre, with which that model doesn't work, because that priority in the city may not necessarily be the priority of that local community. So having that local governance arrangement within the Aboriginal community control health organisations, that's where it's inevitable you do get better health outcomes, because that's a priority the local community sees as a need to be addressed.
Yeah, community-led, community-driven, producing better health outcomes. Who knew? Who would have known? But we all know now because we've got the evidence there. Our mob know, and we knew all along. Their models of care would have changed. this year particularly, COVID-19, the pandemic that came through. Congratulations on the deadly work that Nazi Whip, along with the other peak Aboriginal organisations, did in protecting our communities. I haven't had a chance to chat to you since the beginning of the year, but I think you're doing an amazing job, Karl. Keep it up, brother. You're deadly, and you're representing our people and our profession well, leading us forward. But let's talk about the role of Aboriginal health workers during the COVID response.
Mm-hmm.
And what would things look like without them playing their part?
Yeah. Well, I suppose, from our perspective, when COVID first hit, we knew that our professions, our memberships, they needed support. So we actually led with the Indigenous doctors, Indigenous nurses, midwives, and allied health. We actually led a project to develop up a set of posters, to support our professions, Aboriginal and Torres Strait Islander health professionals, plus also a set of posters for our communities, so that our workforces out there could actually print off either A4 or A3 size and put these around community. So some of the slogans that we used, elders respected, not neglected, be smart, stay apart, proper distance for resistance. So we really made sure that what we developed was broad enough, to be taken on by our mob throughout the country. And that was one of the initiatives. But then we also, held a series of yarning sessions for our members, because when they did lock down communities, we were having phone calls, people ringing up. They felt this sense of isolation. It was all new of these feelings that they had. They'd never felt them before, because we hadn't had a pandemic like this. So we held a series of online yarning sessions. It was really a place for our members to be able to debrief, with other members, have a yarn, and they actually realized that what the feelings that they were feeling, other members throughout the country were feeling those same feelings of like isolation, So from there, our members, we said to them, what would you like? We can organise guest speakers. And so it was mainly around social and emotional well-being. So we got some Aboriginal psychologists to come on and have a yarn, with our members around healthy ways of dealing with, stress, anxiety through the COVID crisis. And I suppose the other big resource that we developed to support our members, so the government announced, instead of face-to-face consultations, you could do it by video conferencing or teleconferencing. So we overlaid those, they call them Medicare item numbers. So we overlaid that to the face-to-face, and then we developed up a client's entry and exit into a health service, so like a flow chart. And so it was to ensure that our members were practicing safely by undertaking video and teleconferencing consultations with our people. So that was released, and our members were able to use that as a resource to be able to practice safely through COVID-19.
Okay, and like you said, you were supporting people to do their job, nurturing them as well. I know it made a big difference to our profession, to our mob, and an amazing initiative. You mentioned numbers in there too, and I guess this goes back to the recognition of the profession, right?
Yeah.
As part of building that recognition, Aboriginal health workers, Aboriginal health practitioners, there are certain Medicare items that can be claimed, right?
Yeah.
To support us in our practice.
Yeah. So that's exactly right. We have the Aboriginal and Torres Strait Islander health practitioner, especially around the 715, the health assessment. So there's 7 specific item numbers that the health practitioner can claim. Of that, the Aboriginal health worker can claim 3 of those item numbers. So the other 4, the argument that we've put up to our MBS review committee was that the other 4 item numbers aren't around medication, so why shouldn't the health worker be able to claim them? So we're still waiting on a decision for that to come down. So not only, employing Aboriginal and Torres Strait Islander health workers and practitioners, not only does services actually increase their revenue, but our clients' care, treatment and management of their conditions also goes up as well. And that's where you get better health outcomes for our people.
That's right. And for those international viewers dialing in to our chat today, the Medicare system, that is our health financing system across Australia, it enables, like Brother Karl said, enables items to be claimed, services to be remunerated in order for workforce to be employed and for that care to be provided. So yeah, thanks for indulging me on that, brother. I also know that there's some items there, some key activities that we've seen introduced for eye care. And what that has done is it's enabled some of that task shifting to occur. We see new items within the Medicare health financing system, pretty much acknowledging the role that Aboriginal and Torres Strait Islander health workers and Aboriginal health practitioners play in the delivery of eye care. And so I guess I'm keen to hear from you, Karl, what you see as the role of Aboriginal health workers and Aboriginal and Torres Strait Islander health practitioners in supporting access to healthcare.
Yep. So more often than not, we hear and we see that Aboriginal and Torres Strait Islander health workers and health practitioners, they organise the visiting eye health clinics, the visiting specialists. So they're getting all the preparation ready for the specialists to come in and undertake the screening, but also not so much as, well, the health worker or practitioner may even do the screening, but then the actual diagnosis, by the visiting specialist, that will be undertaken. But then not only once the specialist actually leaves the community, the follow-up, in the eye health program, which may be running there, Aboriginal and Torres Strait Islander health workers and practitioners are very much involved in the follow-up care of clients who have, whether they require referral off to other services or in terms of accessing eye health products, such as glasses, etc. And even, if they do go for cataract operations, they're always involved in that client's care and in terms of assisting the client to navigate through the healthcare system.
We know, or particularly the health system in Australia can be challenging to navigate. We've got various service providers, all at different levels. In eye care especially, often primary eye care is provided by primary healthcare workforce. You've got the secondary provided by often our visiting optometry eye care services into Aboriginal and Torres Strait Islander communities. And then the ophthalmology, that sits at the tertiary level again. So how vital is that system navigation to ensuring that people get access to the care that they need?
Yeah, that's exactly right. I suppose we have the Dr. Chris Baker, I know that he's previously been interviewed, but I know that he takes part they have an eye health van that goes around to communities, and so in terms of preparing, to access tertiary settings, taking the measurements, of the eyes, they're able to do that, out in the community. So our people don't have to go into these major townships, for some measurements that can be taken out in their community. So they may just, rather than going in 2 or 3 times, they'll just go once for their operation or treatment, and then they return to community, because it comes back to our strong cultural connection to country, and us being off country for a long period of time, it's not actually healthy for us.
But we know here in Australia, Aboriginal and Torres Strait Islander people, 3 times the rates of vision loss and blindness amongst our people. That's the gap we talk about. If we invest in our local Aboriginal health workers, our Aboriginal Torres Strait Islander health practitioners, equip them with the right skills, with the right equipment, have the support and professional development, nurturing, caring professional body like yourself, gap's gone. There we go. I just sorted it out. It's the Australian government. That's the way. But just to change gears a little bit, Karl, you're currently the co-chair of the National Close the Gap campaign for our global audience. Can you tell us a bit about the campaign and what it does?
Yeah, so the National Close the Gap campaign, really kicked off in 2006-7, and what it was, we were seeing Aboriginal and Torres Strait Islander people, being disadvantaged, across a range of a number of areas. In 2008, the Australian government formulated the National Closing the Gap campaign or initiative, whereas the Close the Gap campaign seems to, ensure that keeping the government accountable, to addressing the health, the social and cultural determinants of health. And also, we release a report every year. So the Aboriginal and Torres Strait Islander Social Justice Commissioner, June Oscar, and myself are the co-chairs of the campaign. And when we release a report every year, that really does take a strengths-based approach. It actually looks and highlights, these positive and beneficial programs that are actually getting really good health outcomes, not just health, but, educational outcomes as well. So right across the social and cultural determinants of health, we highlight in the report every year of what great programs that are actually working. We have seen the rise of our Indigenous Rangers program and, caring for country. So, we highlight different programs that we think, that are really actually working and, who knows, could be replicated across the country. So it's really taking a strengths-based approach, not a negative narrative. It's actually a positive narrative that we see within the National Close the Gap campaign. Some of the recent initiatives we've been involved in is to actually highlight and advocate for alcoholic labels labels on alcoholic beverages for women who drink in pregnancy, rather than just have a black and white. We advocated for red, so it actually does stick out of that label. That's just one of the initiatives that we've been involved in through the National Close the Gap campaign.
Obviously, partnerships are critical to that. And we at the Fred Hollows Foundation, we recognise that many of the drivers of eye health inequity sit within the broader context of inequitable health. Social and inequitable health, social and economic outcomes. Our support of social justice reforms is underpinned by the principles of self-determination and supporting Aboriginal and Torres Strait Islander leadership and their voice. What are the kind of things that non-Indigenous organisations like the Fred Hollows Foundation can do to be good allies to Aboriginal and Torres Strait Islander leaders and organisations?
suppose if we take the Close the Gap campaign, we have over 50 members, broad membership, but then we actually have, which actually support initiatives that are developed up by the Indigenous leadership group. So we have an Indigenous leadership group, which actually does set the agenda and strategic directions, of the actual campaign. So I suppose organisations, such as the Fred Hollows, becoming a part of the Close the Gap campaign to really support some of the initiatives that a lot of the other peak national bodies that sit on that are campaign members to ultimately, get better social, economic, and health outcomes for our people. We just think, why should one race of people need to, have worse health outcomes than other races of people? In terms of accessing health services, it doesn't matter if you live, health is a human right, so no matter if you live in remote areas, you should have access to the same level of healthcare as what people do in the cities, Yeah.
No, I'm joking, mate. We're not on mute there.
There you go.
That's the end of our formal questions, Karl. Before we go, was there anything that you wanted to touch on today?
Yeah. Well, I mean, look, COVID-19 has really, I suppose, it's really highlighted the fact that this was basically an attack on the human race as we see it, as we know it. So we did see Aboriginal Torres Strait Islander leaders step up to the mark very early on in the piece. That is why we have not had one Aboriginal and Torres Strait Islander death contributed to COVID-19. So our leaders stepped up to the mark, ensured our communities were locked down, were protected. We're the oldest living race of people. We have cultural knowledge that sits with a lot of our elders, to ensure that cultural knowledge lives on, and is passed down to our future generations. It was so important that our leaders, and I really do thank them for standing up, in the beginning to ensure the protection of our culture into the future, by, really lobbying government and putting out, putting themselves out on a limb. But, it's actually proven that whenever programs or pandemics, that come along, in the involvement of Aboriginal and Torres Strait Islander people needs to be a prerequisite in any health service delivery, health service response, pandemic response. Yeah.
That's brilliant. Definitely things we can learn from. It is brilliant. Such a privilege and a pleasure. You're talking to me and Karl from Nazi Whip. Good on you, brother. You stay safe. And as always, stay deadly, brother.
Thanks very much, Shaun. Pleasure to have been on the Shaun with you today.